The next phase of the process is the actual interview process, what the physiotherapists call the subjective assessment. I normally welcome the patient into the room. I'll ask them to have a seat. You got to remember, you want to make your patients feel as comfortable as possible, because for quite a few patients this might be the first time they're coming to a physiotherapist, and they might not really know what to expect. So making them feel comfortable is our top priority during the session. So once they have a seat, we go through our assessment, subjective assessment again. Now remember, the patient has already filled out that form, so we are going to have some information to confirm and dwell deeper into. Now the first question I like to go through: how can we help you today? Now, what I can offer to a patient and what a patient wants in return can be two completely separate things. So during this objective assessment process, I want to know, how can I help the patient? And the second question in the form is a body chart. So people can normally circle or tick certain areas, or they can mark if it's the pain that they're worried about, or sometimes it might be weakness. We like to focus on exactly what the patient wants worked on. Before we start the actual assessment process, we do confirm a bit of a medical history. We want to make sure there's been no recent accidents, there's been no major illness in the past, there's been no history of any cancer or unexplained weight loss or weight gain. So all of these things, just you want to double check everything first before we start the actual process. And once all that is clear and we know why the patient is here, I don't write any notes while I'm talking to the patient. My full attention is towards the patient. I'm looking for clues as to what might be going on and how I can add value to this person's session. We talk about the symptoms. So most of the patients that we come across, they've come in for pain relief. So they might have had chronic pain which has been going on for a long time. So we want to know exactly where is the pain first of all. We'll ask them questions, what makes it worse, what makes it better. We're going to ask a very detailed and long-term history of this problem. When was the first time this happened? Little questions like that, which just help us understand in a greater detail what is actually going on deep down. Now, the superficial level of all these questions is trying to find out where the pain's coming from and what's causing the pain, but I really want to know, how is this pain or any symptom affecting this person's life? It could be that this person has to run a half marathon in 3 months' time and it's really bothering them. Or we might have an elderly patient who's come in for treatment. They are suffering from stress because they can't pick up their grandchild and play with them. So we really want to know, what is it that this patient wants to achieve in the long term. Now that will also help us guide the treatment. The next phase of our interview process is to educate as well. Sometimes people don't have a medical background that come to us, and they might be getting strange sensations in their body, pins and needles, numbness, and for them that's a big deal. But as physiotherapists, we might know that that particular symptom is being caused due to a particular compression somewhere in the neck or the back or something along those lines. So the reason we ask all these questions is to educate the patient as well. Now, once I've asked them all of these questions, which can take up to 10, 15, sometimes even longer, I don't cheap out on my time for the first session, because I really want to know what's going on with this person. Now, once all of this is done, then we can move on to the next stage. And before we do that, we give patients a chance to ask us questions at any stage during the process. In fact, I really encourage people asking questions throughout the whole process, is so we can educate them as we go through the process. And once all that's done, we then move on to the next phase.